15-minute or less lecture series, Human Anatomy, Chapter 23, the Respiratory System, Part 1. So the respiratory system structurally can be broken up into the upper respiratory system, which includes the nose, nasal cavity, and pharynx, and the lower respiratory system, the larynx, trachea, bronchi, and lungs. The conduction zone, for a functional separation, is the interconnecting tubes, both inside and outside the lungs, whose primary function is to route air in, it's carrying air to deeper within the lungs. So just tubing carrying air. Additional functions of the conduction zone include sense of olfaction, receptors for smell, filtering the inspired air, removing particulates from the air, production of sound, phonation, and also excreting small amounts of water and heat to help condition the air. The respiratory zone, on the other hand, is where the gas exchange occurs, where oxygen enters the bloodstream and carbon dioxide comes out. And that occurs specifically in microscopic structures throughout the lungs, including the respiratory bronchioles, and the alveoli that make up these alveolar sacs. The function of the respiratory zone, of course, gas exchange. It also functions to help regulate blood pH. So breathing carbon dioxide out can help raise the pH of the blood. So if you need to remove a lot of carbon dioxide to raise the pH, you just breathe faster and harder. All right, the nose externally has a bony framework region of the nasal bone, part of the frontal bone, the maxilla bones, and also a series of cartilages that help to form the anterior portion of the nose, including the lateral nasal cartilages, the septal cartilage, the alar cartilages that flare out on the sides. Looking inside, we see that we have a nasal septum, a wall that separates the nasal cavity into two sides, formed from the ethmoid bone, the vomer, and the septal cartilage. So this forms the wall in the middle of the nasal cavity. And of course, the nasal cavity overall includes additional bones, the frontal bone, nasal bone, the ethmoid bone, sphenoid bone, palatine bone, maxilla bone, lacrimal bone, just to name, well, most of them. You also have the inferior nasal concha on the lateral walls. The internal nose, the nasal cavity, initially the internal nose starts off with the opening to the nose. These are the external nares. We might think of them as nostrils. And then the little bit of space after that is the nasal vestibule. These are tiny anterior cavities about the size of a fingertip. And then behind that, posterior to that, is of course the large space, the nasal cavity, that is lined with mucous membrane that contains cilia to move the mucus out of the nasal cavity toward the throat or pharynx. There are the nasal conchae, the three projections off of the lateral walls. So there's three pairs of these. You have the superior nasal conchae, the middle nasal conchae, part of the ethmoid bone, and then the inferior nasal conchae, which is a bone of its own. The grooves that air passes through between these conchae are called the meatuses. So you have the superior nasal meatus, the middle nasal meatus, and the inferior nasal meatus. And by having the air run past these projecting structures, it helps increase the overall surface area to which the air is exposed to help warm it up, moisturize it, and remove filtrate particulates. Here's just a coronal or frontal section. Again, here's the nasal septum. Here's the middle nasal concha, superior nasal concha, inferior nasal concha. You also have on the roof of the nasal cavity the olfactory epithelium. This is where we detect the sense of smell, where chemicals dissolve into the mucus and bind to the receptors. And then finally, the back of the nasal cavity is the internal nares, which open up to the pharynx posterior to that. There are openings within the nasal cavity for all of the nasal sinuses, and also an opening coming from the orbits in which tear fluid, lacrimal fluid, can drain into the nasal cavity. So internal nose functions: olfaction, sense of smell, resonance for speech, especially the sinuses help to give more resonance to our speech, filtration of air, warming of air, moisturizing of air, and conducting air to or from the pharynx. Oral cavity is not considered part of the respiratory system, but we know we can breathe in and out of our mouth. Pharynx, or throat, the back of the throat, goes from the internal nares down to just above the larynx and esophagus. The pharynx comes in three regions. First region is the nasopharynx, which is from the internal nares to the soft palate, It includes the opening to the auditory tube coming from the middle ear and the pharyngeal tonsil. After that is the oral pharynx. The oral pharynx is directly posterior to the oral cavity. It includes in its area the palatine and lingual tonsils. And it goes down to approximately where the hyoid bone is. And then finally the laryngopharynx, which goes from about where the hyoid bone is down to just above the esophagus and larynx. The function is for the pharynx is to conduct air between the nasal cavity and the larynx. The larynx itself is a larger widened area that allows air to pass through. So its one function is to conduct air between the laryngopharynx to the trachea or from the trachea. And also the larynx is involved in sound production, which allows us to do things like speak. Here is the larynx from a cadaver as well as the larynx from our model. As you can see, it includes the epiglottis. This epiglottis or leaf-like piece of elastic cartilage will cover the larynx when you are swallowing to route food and liquid to the esophagus. So the important job of not letting food and liquid go into the larynx. The thyroid cartilage, this anterior cartilage, is the largest cartilage of the larynx, and it is gives structure to the larynx and is attached to the hyoid bone by the thyrohyoid membrane, seen here and here. The cricoid cartilage is the inferior piece of cartilage for the larynx. It is a ring of hyaline cartilage, and it connects to the trachea via the cricothyroid ligaments. Cricothyroid ligaments. And it attaches to the thyroid cartilage by the cricotracheal ligaments, as shown up here. The arytenoid cartilages are small, sort of triangular cartilages. There's two of these. They are made of hyaline cartilage, and they are able to move to a certain degree. On the very top or superior border of them are the tiny corniculate cartilages that are shaped kind of like little horns made of elastic cartilage and are also movable by contractions of muscles. And then finally, you have the cuneiform cartilages, two of these on either side. Cuneiform cartilage are two club-shaped cartilages that help to support the vocal folds. That includes the superior vestibular fold and the inferior true vocal fold. So the vestibular fold is mainly a structural element that can close to stop air from passing through the larynx. The inferior true vocal fold, on the other hand, is what vibrates to produce speech. Here we're looking down into the larynx. So here's the epiglottis, the cuneiform cartilage. Down here is the true vocal folds. The narrow passage between the vocal folds is the glottis. The overall structure is the glottis with the space between the vocal folds, the rima glottis. When you increase tension or decrease tension on the vocal cords, this changes pitch. So increase tension, it makes the pitch higher. Decrease tension, it makes it lower. And this is done by muscles within the larynx. And if you want to increase volume or decrease volume, you just change the amount of air that is passing through the larynx. So increase the volume, you get louder, and decrease the volume and force, you get softer. All right, the trachea. The trachea is inferior to the larynx. It is anterior or in front of the esophagus. At its inferior side, it will split into the main bronchi. Its main function is to conduct air between the larynx and the main bronchi, and it does some filtering of air because it is lined with a mucous membrane that produces mucus and has cilia. Here is the trachea. You can see the trachea is made up of these partial cartilaginous rings that form sort of a C shape that holds the trachea open at all times, while it has a muscular area directly next to the esophagus, so that when you swallow, food bulges out and it doesn't damage the trachea. The trachea has 4 layers of tissue. The innermost layer is the mucosa, made up of epithelial tissue, specifically pseudostratified columnar ciliated epithelial tissue and goblet cells that produce the mucus. The next layer is the submucosal layer, made up mostly of areolar connective tissue, has some embedded glands, especially glands that produce mucus. Then you have the fibromusculocartilaginous layer, made up of smooth muscle tissue and elastic cartilage. This allows the diameter of the trachea to change slightly. And of course, as I mentioned already, the C-shaped hyaline cartilage rings that help to keep the trachea open at all times. And then the outermost layer is the adventitia, made up primarily of areolar connective tissue. If someone gets a tracheotomy, that means there's a hole placed into the trachea below the larynx, and this is needed when there is some sort of obstruction that's preventing breathing as you normally would be expected. Subscribe and like below.